Now our focus on this fresh news that has emerged on coronavirus, where Chinese researchers discovered a new kind of coronavirus, NeoCov, which is spreading among bats in South Africa. In their study, the scientists say the virus may pose a threat to humans in the future. The World Health Organization has said that NeoCov coronavirus discovered by Chinese scientists requires further study. They say they're aware of these developments, but for the moment, there need to be more studies to find out what the risk is to humans. Well, to talk more about this, we're joined by Dr. Subhash Salunke, member National Task Force on COVID, senior advisor, PHFI, also Professor Dr. Neeta Ramesh, senior medical oncologist, Apollo Specialty Hospitals, Chennai. Thank you so much, doctors, for joining us this morning. And Dr. Salunke, first to you. There's been a lot of sensational headlines around this news. It's talked about this new coronavirus and how deadly it's going to be for humans. If you could explain to our viewers just what this discovery is.
Good morning, Gagi, and thanks for giving me an opportunity to speak to audience. First and foremost, I am so delighted that in a very short span of time, a virus which is going to, or variant of the virus getting developed in South Africa, picked up by China, and WHO is giving warning signals, and that too happening literally in 24 to 48 hours. Entire world comes to know this is something very, very positive sign that global cooperation is taking place. This particular virus, which we know it's one of the zoonotic, kind of a variant of the corona, and this is primarily a virus seen in the bats, and these bats are the ones which are developing or which are primary source of this particular virus. However, and this is also related to what we call as a MERS, or the Middle Eastern Respiratory Syndrome virus, which once upon a time, that was about 20 years back, created havoc and created a panic in the world. So there is definitely a concern whether this variant is likely to jump the species from bat to the human beings, and will it become another serious potential for the pandemic. So that is the concern, and which is a very rightful concern. Even though people at this juncture need not get unduly panicked, because there is no evidence that it has already jumped the species barrier. It has not happened. But the chances cannot be totally denied. Even though they may be remote, the chances cannot be denied. And from that perspective, I feel the care and the precautions that are being suggested by WHO or that are being suggested by the technical bodies, whether CDC and others, that is something which we need to take it very seriously. This virus is this new development or new variant is an indication that we cannot afford to say that, okay, this particular pandemic is going to be over next in few months or say year, and then we could consider that it is over. No way. Now, the zoonotic diseases in last 20, 30 years have given so many variants, viral variants or viruses, that this is going to eventually become a very serious potential threat to the humanity. And from that perspective, every nation, everywhere, we need to develop the public health capacity, including virological investigation capacity, which unfortunately in our country is not paid attention to that extent that it should have been done. And I think this is a warning signal for everyone, including our own country, that please do not ignore public health capacity building of this country. No, very critical one.
I think that's the big lesson
that we are getting out of this. Yeah.
Right, from the pandemic. Dr. Neeta Ramesh, your view on this, because I think people are getting confused. They feel that this is a new variant of the coronavirus that's currently causing the pandemic, but this is a whole new coronavirus, isn't it? If you could just explain to us, and like Dr. Salunke said, that, right now it's good that we know about it, we can get prepared, but this is not some sort of imminent, immediate threat.
This is a virus, basically couple of things. The data is not published in a peer-reviewed journal, so we are not sure about the authenticity of this particular virus. It has only come in a website called BioRix, based on which the Chinese, the WHO, and even the Russian agencies are warning the government. So first thing people need to know, it is not published yet. Secondly, it is a type of a virus which has only affected animals. It's a zoonotic disease. There is a potential threat might come to human beings. for which we do not know. We don't have the data for human infection. Point number 3, it enters through a receptor called the angiotensin converting enzyme, ACE. We saw the Delta virus in India when it affected. It did go through the ACE and had caused some cardiovascular problems. So that is another threat, but we do not know whether the virus will affect human ACT2. So this all leads to our conclusion, yes, there is emerging data, there is zoonotic or bat infection in South Africa. It has got published in the website, not in any peer-reviewed journal, but yes, we all need to be aware of it. And it's called a variant of concern, but it's not a variant of threat to humankind. See, lots of researches will take place, Gargi. Lots of publications take place. Even with cancer, we have so many drugs, but not all comes to the clinic. And not all viruses are virulent. So yes, it's an information to be alert of, but the people should not get panicked because such type of variations and mutations will keep changing as a part of the natural history. So keep your fingers crossed. A study has come. Yes, we need to wait for more authentic data before the public becomes frightened about it.
Right, I think it was the headlines that were very sensational around this new coronavirus. So there was a lot of panic over it. And now if we talk about the current situation in India, and Dr. Salunke, if we, the cases are coming down. Again, the fresh cases have come out and just like over 2 lakh cases. So can we safely say 2,35,000 cases? Can we safely say now that we're seeing a plateau of the third wave and the worst is behind us? We've seen the peak?
I think as far as the country is concerned, certainly we could consider that plateau is taking place. However, country of the size of India, it is very difficult and it is improper for us to take nationalistic or national level view. It has to be at the, comparatively low, that means, states, district level. So localized developments are going to be extremely critically, need to be evaluated critically and acted upon. So for example, now you have stated, also in Maharashtra, the deaths have gone up, and Kerala, the deaths have gone up. Cases have come down, positivity has come down, but the deaths have gone up because there is definitely a lag period. So under the present circumstances, we shouldn't get, as if things are getting hunky-dory and we should forget about it. Sorry, you cannot forget about it. At least till the time we are going to reach that particular level nationally, let us consider that we are still not out of the woods. Please do remember, we need to follow the basic precautions and COVID-appropriate behavior. There are some people talking about no mask. I think that will be unwise. Please don't do that. Unnecessarily congregation, unnecessarily giving opportunity for virus to multiply, giving opportunity for virus to also develop into a further variant. Look, right now we have Delta variant ongoing as well as Omicron. So do not why do we need to take such risks? Right now we know the strategies. These strategies are proving to be useful. So let us follow that at least for next few months. We are not out of the woods.
Right, and continue to be careful. Final comments, Dr. Anita, on this and the fact that, yes, there is a lag in cases. So while cases are coming down, we're seeing a high number of deaths, 613 deaths, fresh deaths in the last 24 hours and a backlog of some 200 deaths added from Kerala.
Yes, see, the number of new cases is not a true representation of the cases in India as per the ICMR guidelines, and we are not testing many people, which we were doing first and the second wave. So the number does not reflect. Okay, maybe the positivity factor can be taken into, it is still high, it's more than 10, you showed 13%, but in some states it is 5. Yes, deaths are there because remember, all cases are not Omicron. Maybe 80-90 is Omicron. The remaining is the previous virus, the Delta, which has caused cardiovascular complication, does have thromboembolic manifestation, does involve the lung. Yeah, even yesterday I had 2 cases with lung involvement. Today I got a report of one patient, 62% lung involvement, admitted in a government hospital. So yes, that Delta variant is still there and that may be the cause of the death. So not to underestimate it, yes, deaths are more, maybe the Delta is that. Omicron might not have caused the death, but then there are other unrelated or non-related issues to the death of these viruses. So it's to be taken, the figures has to be reanalyzed and sub-analyzed to give us this thing. But my thing is there may be a light dip in the cases, but then there are a lot of cases which don't get picked up because we have new guidelines as per ICMR.
All right. Well, thank you so much, doctors, for sparing your time and joining us on the program this morning.